when I was 17. I was on every medication. I struggled with it for years. And meanwhile, I work in the healthcare setting. So I had access to all the best drugs to help me with it, but I still suffered from migraines. And it just so happened that one day, one of the nurses I worked with, she said, "Hey, I do the sedation for an oral surgeon at a dental office, and I'm going away this week, and I'm wondering if you would cover me." So I thought, okay, sure, why not? So as I'm sitting there, the patient's asleep, and I'm monitoring, and I'm looking around the dental office, and I see a sign, a poster that says, "Ask your dentist about sleep apnea." And I'm thinking, well, sleep apnea is a medical issue. So why would a dentist have a poster telling people who come here? I looked at the dental offices, that's where I go to get my teeth cleaned before an event or I'm going on vacation, right? I didn't, and so I was like, why would you tell people to ask you about a medical condition as serious as sleep apnea, when that should be sent to the doctor? So they started talking to me about the way that the tongue would fall back and occlude the airway, and that you could move it forward with this appliance. And that fascinated me. And I was like, how is it? I've never heard of this. And so I started asking more questions, and this provider taught and he lectured around the world. So I started following him, taking all his courses, only to discover that in all my years of nursing and training and education, I mean, I even went back to my textbooks and I looked like, did I miss those classes somehow? And I looked in my big, thick textbooks, and there was like a paragraph, maybe two paragraphs about sleep and sleep apnea. And what we were advised to do as nurses is on night shift is group your care. So group your care, so you're not going in and out, and you allow at least a 3-hour window of sleep, or at the very least an hour and a half. But you're kind of, that's all we learned about it. And so I just felt like all of these years without knowing that piece, all the people, I thought back of all the people and all the things they complained about and all the times we told them there was nothing wrong with them. But actually, they were all suffering from sleep apnea. All the people who came into the emerge at night with palpitations, all the people who had metabolic disease, or depression or anxiety, and all those people, because we didn't understand and we weren't taught about sleep,